Hello, you're watching It's About Youth with me, Fei Kwan. World Suicide Prevention Day falls on September 10th every year, and the triennial theme for this year up until 2026 is changing the narrative on suicide. Joining me on the show today to start the conversation on this topic is Dr. Chua Sook Ning, a clinical psychologist and founder of Relate Malaysia. Thank you for joining me in the studio today.
Thank you for having me, Faye.
Pleasure having you. Now, firstly, I have to ask, based on your observations, your time in this industry and field, what would you say are some of the most pressing mental health issues among youth today?
I would say not just my experience, but the data is very clear. So common mental health issues include depression, anxiety. We often talk about stress, but stress is not a mental illness, right? It is the precipitant or the a risk factor for poor health in general. And then we do see a rise of suicidality, which may or may not be due to mental illness, but it is one, depression is one of the key risk factors for suicide. So we can look at the National Health and Morbidity Survey for adolescents 2022. Depression was rated, at 26.9%. That's a huge increase from the previous 2017 data, which is 18.3. So we're almost seeing the doubling of prevalence. We see that the same for the most recent National Health and Morbidity Survey for adults. Nearly 5% of adults in Malaysia report being depressed as compared to, I believe, 2.9. So we see that our prevalence is on the upward trajectory. And we are thinking youth, are we doing the broadest age group of perhaps 16 all the way up to 30 or 18 all the way up to 30. That's about the onset of depression and anxiety are often late adolescence, early young adulthood.
Well, thank you for presenting the figures. That makes me a bit curious. Is this a higher prevalence, or is it more people coming forward to talk about this and less shame in reporting themselves? Or is it a mix of both?
Right. Well, I think anecdotally, it could be due to what you were talking about, right? Are people more willing to report it? But since the National Health and Morbidity Survey are surveys, right? So people go and they're going to survey nationally representative population and go door to door knocking. So we can't say that these are the numbers we see are a result of help seeking, right? So help seeking is still low, but we do see an increase in prevalence on the data that we use the same measures repeatedly.
So it's a bit hard to generalize.
It's a little bit hard. I believe there's an increase. I mean, globally we see an increase, especially after COVID-19. I don't think there's a reason to doubt only Malaysia remained the same. So we do see an increase. And hopefully, clinically, we see an increase in part due to that increase of help seeking.
And as you mentioned, things such as depression and anxiety, those are sort of related and they tie in with suicidal tendencies. Yes. Speaking about the theme for Suicide Prevention Day, changing the narrative on suicide, where do you say Malaysia stands in terms of our attitudes towards this kind of topic? And where do you think we can begin to sort of open up the conversation and help to shift these attitudes on such a complex issue?
I'm glad you recognize it's such a complex issue, right? So I don't want to be cavalier about it and give some easy solutions for that. And let me give I think the boring but true answer. There's a lot of stigma around suicide. We know we had the penal code that criminalized suicide attempts. It was just decriminalized. But think about what it did to our country in shaping attitudes, in addition to obviously faith, attitudes against suicide. The law was telling us it was wrong. And it shaped our treatment of people with suicidal tendencies or with thoughts or who have attempted suicide. And we see that from reports from qualitative studies where people have gone to healthcare professionals or first aiders and says, I am experiencing suicidal ideation, which are the thoughts and feelings, and they get treated really badly, right? People say, how dare you? Are you not grateful? What's wrong with you? Why do you lack faith? So I think nobody wants a high suicide rate. We want to minimize suicide. We just don't know how to do that. We don't know how to balance I really believe it's wrong, right? And so we're going to push on that, like we're going to shame people in hopes and some idea that it's going to reduce suicide. We have to just recognize it's not working.
Yeah.
Right? That approach is not working. Our suicide rates have actually increased despite the criminalization of suicide attempts. WHO itself has done, there's several studies done now on it, that is not a good preventive measure.
Yes.
What is a better preventive measure is awareness, open conversation, dialogues like what you're doing, right? Like talking that having thoughts of death is actually fairly common, right? Like, and helping the person who's experiencing the distress, but also helping the community on how to respond to it, right? So what do you say if someone has suicidal ideation? So I think that's first is, there's a lot of awareness building, and there's a lot of saying like it's not about us versus them, which is one of the key things that maintains stigma. Like we often see PSAs that says, well, if you need help, you go for it. Yeah. Very few people are still coming out now to say, well, I needed help, so I went for it. And I think those messages, research has shown that those are just more powerful messages. So we need to address the stigma. We can see the stigma not only at the social level, the individual level, but also institutionally. We're not getting a lot of funding. Yep. In comparison to other things, right? That we're not getting a lot of funding for suicide prevention. For suicide awareness is still very much a taboo topic in our country. We are reactive. Yeah. When somebody dies by suicide in a tragic manner that the media picks up, sensationalized, we can see a lot of reaction. Then the next news cycle comes.
And it dies down again.
It dies down again. And so it's such a tragedy. Like how many people do we need to lose before we say no more? Yeah. Right. We have to do something right now, and have something effective. And keep collecting data. If our prevention is not effective, we need to keep tweaking it. It's not a checklist, right? It's really, I think, a mission to reduce suicide.
Every life matters. Right. And as you said, the tendency to sort of in a way guilt trip people for having thoughts of death, made to feel shameful about it. I imagine that's only going to make them feel worse. It's not going to help the situation at all. Yeah,
but again, I can recognize that sometimes people don't know what to do. It's not I'm not excusing them. I do think by and large people try to be helpful. They don't know how to be, and so they resort to that. I think somewhat out of desperation of what can I say or say to you that will stop it. I do think some people are just mean, but I think most people have good intentions, maybe poor ways of carrying out those good intentions.
And hence the importance of awareness on how to handle such an
training.
issue. Yeah, and data. Right. And speaking about data, the Health Ministry, according to the Health Ministry, the National Suicide and Fatal Injury Registry will be completed, expected to be completed by next year or anytime soon. How crucial would you say this registry is for suicide prevention in Malaysia? In what ways can more data here help with us can help inform or perhaps enhance policies and prevention measures?
So I think maybe a good way to understand the importance of data would be to look at the recent COVID-19 pandemic. Why was data then so important? Because we needed to know the prevalence. We needed to know who was most vulnerable to it, the demographic profile, the risk factors. So we could understand, I think, and the public could understand the importance, because people are constantly checking, right? Like, okay, how many reported cases right now? How many people in ICU right now? So we were consuming that information, and without that information, it would be very hard to develop interventions. We wouldn't know we've got to maybe, some of the interventions were wearing masks. I don't want to get into an argument, were they really effective? But, we could then see if we implement an intervention, is it effective, right? That's an empirical question. So without the data now, if I say, well, suicide, is alarmingly high in Malaysia, and you say, okay, how high? I say, well, It's a great question.
Where are the
I'm
numbers?
feeling high, right? And so we need the accurate reporting to understand the scope of the problem. We need to know who's most vulnerable, what demographic, the demographic profile. We need to also know the means of it, because we know that if we limit or restrict certain means, suicide actually reduces, right? And so that's one of the ways that we can then develop prevention interventions. Then we can also test out, if we implement this, if we have this PSA campaign, did our suicide rates actually go down? We need some kind of baseline comparison. So without the data, we're kind of feeling away in the dark.
Yeah.
Right? We don't know how big it is. We feel like it's big. We don't know whether we are effective. We think we are. And so, but this is such a major public health issue, right? I mean, one life lost is not just one life lost. It's 50 people around that one life being affected, right? And you can kind of see the dominoes effect, right? 50 people are affected, then 50 more will be affected, and so on. So it's really the society being impacted eventually by the lives lost to suicide.
Would you say there are still any barriers here that are preventing people from reaching out for help?
Many. I mean, I've mentioned some. I think stigma would be some, sort of the key one. And stigma, you know, really being the broad umbrella, which I think will drive many of the things that we talk about as barriers. So we can say the lack of institutional funding. A UK study, and I don't know what the numbers are in Malaysia, but at least we know that the UK universities probably spend equivalent or perhaps even more than Malaysian universities on mental health support. They only spend £39 per student. Right. That's 250 ringgit. How much money are our school fees, and how much money do people spend recruiting students? So if you look at the incentives for recruiting a student, it can range to 2,000 to 4,500 per student. And they come in, we bring them in, and we're only going to spend on you 250 ringgit. So we know spending is low. We know that for operations, the mental health budget 2023 was less than 1%. We see the numbers of prevalence increasing, but the budget isn't keeping up. Our spending isn't keeping up.
Lack of priority there.
It's a lack of priority. I think mental health is often an afterthought, right? Once we fix the other things, the diabetes issue, the high blood tension issue, then if we've got spare, let's look at mental health. You know, I think there's some angsty teens, right? I think, and that's part of the stigma, our attitudes towards this problem. We're not taking it seriously enough. So we can increase accessibility. I think the government is trying to do that by increasing training, affordability, public health access. So public health treatment is still quite affordable, but it's not always accessible because there's so few. But then the next thing we got to look at is efficacy. Now, I think that, you know, often when we talk to public health professionals or the public, they say, well, how hard can it be to listen? I mean, your job, just talk, right? Just talk, then listen, then they tell you, then okay, right? But, you know, it's such, when somebody goes to a psychologist or a counselor and shares, and the counselor, for whatever reason, didn't give the empathy or the compassion, or wasn't listening well enough to the other person, the person seeking for treatment, it sets the person back. And we see that in at our Relate clinic, that people say, well, you know what, I talked to a counselor 5-10 years ago.
Right. And
they weren't very understanding. So I didn't want to go back. And it took me so long to overcome the disappointment or the hurt or, you know, the discouragement of not receiving help when I sought it. Right? And so we have to also look at efficacy. It is not easy to be a psychologist.
Definitely not.
Really, I love my job, but it's not easy, and there's so much training that goes into it. It is not a one-year training, it's a lifelong training. So we have to recognize and start investing in our training the same way we invest in the development of medicine. So think about it, right? And not to be narcissistic, but we think about what's the active ingredient in medication, so we can name the chemicals. One of the active ingredients in psychotherapy is the therapist. We should be plowing money into the active ingredient of the therapist and ensuring that the people we put out can do the job well enough.
It's also the fact that it's kind of like an invisible disease, you know, for lack of a better word. Hence, you know, you don't really see it and then it becomes an afterthought. But there is this importance, like you said, for more funding and more research because of how it's changing and we're adapting to current times. One thing that has come up quite recently is, or rather it's been around, but it's there's quite a lot of attention around it now is cyberbullying, and a lot of it has to do with, because we've seen the damaging impacts, the worst case scenario in which it's taken somebody's life, you know, and that seems to sort of raise a red alert that it really needs to be taken seriously, including from the side of the government, where, you know, they're saying they're going to review laws that or potentially introduce a new legislation that specifically addresses cyberbullying. From your opinion, are there any factors to really consider when drafting a legislation? Sorry, this is another complex issue, another big issue. Question for you.
And I'm not a lawyer, and so I'm not going to encroach on that issue. I would say, so we know from bullying, and this is a report by the Institute for Youth Research Malaysia. So it's a national institute of youth research, and they only do youth research. So they actually found in a national study about 10% of youth experience bullying. They're actually now doing a cyberbullying study. So again, we need the data to understand the scope of the problem. I would say that we can see repeatedly legislation is necessary but insufficient to shape human behavior. And so looking past that, like, and whether or not you have a legislation specific to cyberbullying or a legislation that covers all bullying, sure. You know, I'm not a legal scholar, but what I know is that how the implementation matters, the way we talk about it matters. How would it be, how would it reach the person who is doing the bullying? Do we understand the causes of it? Because the legislation is often punitive. Right, in a sense, we're going to punish you. Harsher penalties,
jail time.
Jail time, right? But do we even understand that that's not necessarily a social prevention? How do we prevent people from engaging in it? And it's interesting. I don't really have the answer. And I think, you know, because in our human history, social media is relatively new. It's old but relatively new. So what leads someone to be really nice in person, but then they go home and they say the worst things on social media and really target someone else that they don't know? And, you know, part of it are the algorithms of our social media platforms that encourage a sense of anger. They feed it, right? Like everything that's popping up shows us, and it feeds it. Why? Because it gets clicks. So I think, you know, that too needs to be addressed. Right, like how the platform encourages certain types of behavior, in person and in person, but also online. So in person, what leads someone to be so unhappy and to have so much anger to tap into that they go in and pick on someone repeatedly, trying to tear them down in this power dynamic. And so that's what the legislation needs to go beyond. You know, to regulate policies that actually help us to understand and again develop effective interventions for that.
I know it's because it's a relatively new issue. I think everyone is still sort of learning ways to adapt to it. But for you, you know, with your experience practicing in Malaysia, but also in Singapore and Australia, or attending other conferences, are there any international models or best approaches that you think Malaysia can learn from?
I think there are a number. I mean, Australia, we can go with the Scandinavian countries, the UK. There are models we can look at, and the government is well aware. You know, I think that's one thing our civil servants actually do well. They can find the research. I don't think the barrier is the lack of comparisons. The barrier is how does it fit into our culture, and how do we sell it to our people? How do we persuade the public that this is necessary and good.
Yep.
So I think that's the more difficult aspect, but there are many countries have actually already have started, have taken more advanced than us in terms of addressing these issues. The government is for sure studying those already. How to adapt it to our culture, how to make it impactful, I think those questions remain to be seen.
How then do you think we can even begin to sort of encourage people that this is, it shouldn't be stigmatized, like you said, thoughts of death are fairly common. Conversations about these should be normalized, right? So what role can the community play for us to just start to play a part in all of this?
So I think the media plays a big role since I'm on the show. Obviously, conversations like these, but also the way suicide is reported and talked about, right? Language really matters. Having representation matters. Having people that we can discuss, if I use mental illness, what's the impact of it? Does it increase the stigma? Does it make you feel worse, right? The person watching it. More conversations that are, and I think so, this wasn't scripted, but this is what this is my genuine belief. Part of why research is so important and why I'm very passionate about it is because it gives us new things to talk about. The public actually does get bored talking about the same old thing. If I keep saying, well, depression is high, yeah, I know.
You hear about that every year.
I heard about it. So we need something to, especially in today's society. How do we engage them? How do we personalize the issue to them? Not in a way that scares them, but to say, you know what? Research has shown that 50%, 1 in every 2 people will have a mental illness in their lifetime. 1 in 2. It's not us versus them. And so from the top, we got to change our language. The media has to change the language to make sure not to sensationalize distress, not to show pictures that show someone, who have died by suicide, not to say means of suicide, but to talk about the person's life with compassion. Really, rarely I think that voice of compassion and understanding is there. If we can understand the tragedy of suicide in a compassionate way, I do think that we can approach people who are living and struggling with suicidal ideations or plans or attempts more compassionately. So I think all levels of society has to be involved in it. If it's 1 in 2, it is all levels of society. It's not a professional thing. It's not the government thing.
It doesn't discriminate.
It's all of us.
All ages.
So how do we talk about it? So if parents learn how to talk about it, kids learn how to talk about it, teachers learn how to talk about it, doctors learn how to talk about it, all walks of society, you don't need to do it every day. But being informed and not being afraid to talk about it, right? And then on the job of research is to continue to find out new things that can inform our conversations. And then the government's job is to pass policy and invest in mental health support.
And fund that continuous research.
Always funding. We had funding for football, 15 million, right? Surely we can find more funding for mental health. It's at least as important as football.
It definitely is, because footballers are affected by mental health as
Footballers
well.
are affected by mental health. We saw that, right, with the safe sport thing on how footballers and even with the controversy with ray gun, right? No one is exempted from distress. Learning how to manage distress is really an important part of being human.
All right. Thank you so much, Dr. Chua, for sharing your insights on this show. That's all the time we have. I've been speaking to Dr. Chua Sook Ning, a clinical psychologist and founder of Relate Malaysia. This has been It's About Youth with me, Faye Kwan. Thank you for watching and good night.